Hi, hello, welcome to the Agni Nursing Academy. Myself Gangaram. In the last sessions, we have discussed important MCQs which is very helpful in our upcoming NORCET, RRB and other competitive nursing examinations. In the today's sessions also, we are going to discuss the MCQs which is very helpful. The first question on your display is, what is the primary intervention for infant with a myelomeningocele before surgical correction? Option A, minimize the infection. Option B, prevent trauma to the sac. And option C, observe for increasing paralysis. And option D, assess for the degree of bowel and bladder control. In the question asked, the primary intervention for infant with myelomeningocele before surgical correction. Before surgical correction. Is a myelomeningocele is a type of neural tube defect. Before going to the surgery, what we can give the priority intervention, like that question asked. Before going to the answer for these questions, we'll discuss in detail about the neural tube defect. Neural tube defect. The incomplete closure of neural tube is called as a neural tube defect, or the effect in the formation of neural tube defect, that one is called as a neural tube defect. The mainly causes for neural tube defect is causes folic acid deficiency, folic acid deficiency, and the second one is exposure to the teratogenic substance. Exposure to teratogenic substance. These are the main causes for the neural tube defect. We'll discuss the types of neural tube defect. Types. The mainly two types are there. First one is related to brain. The second one is related to spinal cord. Related to brain and related to spinal cord. Related to spinal cord. In the related to brain, first one is anencephaly. In case of anencephaly, the some parts of the skull bones, the skull bones are absent and the brain is exposed to the environment. That one will called as a anencephaly. These types of children, after the birth, the after the few hours, death will be occur in case of the encephaly. And the second one is encephalocele. Encephalocele means there is a protrusion of some parts of the brain, especially on the occipital region, and the sac-like structures will be occur. That one will called as a encephalocele. I will show the image in the next slide. And related to the spinal cord, the first one is the rachis. Rachis. The rachis means the large area of the vertebral column is open and exposed to the environment. That one will called as a rachis. And the second one is the spina bifida. Spina bifida. Spina bifida means there is abnormal opening present in the vertebral column. That will called as a spina bifida. We'll see about spina bifida. Spina bifida, I told you there are two types. One is occulta, spina bifida occulta, and second one is spina bifida cystica. In the case of spina bifida occulta, what will happen? Abnormal opening will be present in the vertebral column, but skin is intact, and skin is intact, and where the location it occurs in that locations, tuft of hairs, and there is a Potvin stain and dimple in the skin dimple in the skin. It's present in the location of spina bifida occulta and the spina bifida cystica. There are two types will be present. First one is meningocele. Meningocele means the abnormal opening present in the vertebral column and protrudes the sac-like structure. In that protruded part, only the CSF and meninges will be present. Only organs protruded in the meningocele, the only meninges and CSF. That one will called as a meningocele. And the second one is myelomeningocele. Second one is myelomeningocele. In case of myelomeningocele, all the parts are protruded in the sac-like structures. Means CSF, spinal cord, spinal nerves, and meninges. The sac-like structures contains all the organs are protruded in that sac. The mainly spina bifida cystica. The location is lumbosacral region. Lumbosacral region. Here I will write. Cystica location is lumbosacral region. That one from S5 to S1. That one L5 to S1. Okay. This is about the myelomeningocele and spina bifida types. Next we will discuss. See here the images of this one is the encephalocele. This one is spina bifida, and the third one is anencephalic. Anencephalic. Okay. How we can diagnose that one neural tube defect? Diagnosis. We'll take the amniotic fluid. In that amniotic fluid, we will assess for maternal serum alpha fetoprotein. Maternal serum alpha fetoprotein level will be assessed in the amniotic fluid. If the level is increased means that is neural tube defect. If level is decreased means it's a Down syndrome. And the another one is the test that is acetylcholine esterase. Acetylcholine acetylcholine esterase test will do in the especially in the 16 to 18 weeks will assess for the neural tube defect. In this we'll check the acetylcholine esterase level in the amniotic fluid. If the level it is a present means neural tube defect. It's a level the acetylcholine esterase is absent in the amniotic fluid means that one is the normal finding. These tests will do for the identification in the antenatal mother. In the postnatal mother, what we can do means we'll do the physical examination. By doing the physical examination also we can observe. And the second one is trans illumination test. In the case of trans illumination test, we will this one used for the assessment and differentiate between the meningocele and myelomeningocele. To differentiate, trans illumination test will be used. Means in that one torch like structure which is present, that light will be focused on that the particular sacs which is protruded, and we can observe that which organs are protruded in the that particular protrusion organs. Which organs are present we can identify in the case of trans illumination test. And what we can do for the this one management for that management, the initial management for that neural tube defect in case of the spina bifida, especially in cystica. First one, we have to give the prone position, and we have to protect that particular sac, protect trauma to the sac. And third one is the we have to cover dressing, sterile dressing, sterile saline dipped dressing, saline dipped dressing will do for that protruded organs, and it covers with a membrane. Afterwards, we can it for the surgical correction will produce organ put it inside, and afterwards surgical correction we will do for that. How we can prevent this one? Prevention folic acid to the mother. Folic acid to mother, pregnant mother. First one is if the first pregnancy, if the first pregnancy will give 400 microgram per day folic acid to the mother, and there is a risk or previous risk of NTD or previous history will give the 4000 microgram per day, 4000 microgram per day for the mother to prevent the neural tube defect. Now we will see the our questions and options. First one is the minimize the infection. It is the priority, but if the sac which is covered with membrane, if it is ruptured, means there is a more chances of infection. That's why first, before going to minimize the infection, we have to cover the sac. That's why we have to protect the trauma to the sac. That's why this one is the second priority. We can give this one also correct, but it's a second priority. First priority is we have to prevent the trauma to the sac. First one is this is the first priority, and answer for our question is option B. And we'll see the next option. Observe for increasing paralysis. Yes, we have to observe, but in the later condition. But first priority it is not. And option D, assess the degree of bowel and bladder control because of effect in the spinal nerves, which is controlled by our spinal nerves, our bowel and function of the bowel and bladder control. Later will be affected. We have to see this one also, but it's not a priority in this question. Okay, the option B is the correct answer for our question, that is prevent trauma to the sac. Okay, now we will go to the next question. A parent and 3-month old infant are visiting the well baby clinic for the routine examination. What is the best nursing teaching plan to the parents? Option A, remove small objects from the floor, and option B, cover the electric outlet with the safety plugs, and the option C, remove toxic substance from the low areas, and option D, test the temperature of water before bathing. In the question asked, a parent's 3-month old infant visiting well baby clinic for routine examination, best teaching plan to the parents, like that question asked. We'll see the one by one option. The first option is remove the small object from the floor. Yes, this is the priority, but in the 9 months old children, this is the priority, but child given here the 3-month old, in this child there is a no pincer grasp, child is not able to grasp that objects also. That's why this one is the not priority in this question. And the second one is cover the electric outlets with a safety plugs. But the 3-month old child is not able to do crawling and crippling. If it is, then means it is not able to touch that plugs also. That's why this is also not the answer for our question. This is also not priority. The option C, remove toxic substances from the low areas. The child is not able to roll over, and the child is not able to that grasp that particular substances also, because of child is 3-month old. That's why this is also not priority. But 3-month old child we are giving daily bath. That's why the priority answer for our question is option D. That one is the test the temperature of the water before bathing. Option D is the correct answer for our question. Okay. Now we will see the next question. Which of the following is not a feature of Down syndrome? Option A, simian grace. Option B, macroglossia. Option C, microcephaly. And option D, hypotonia. Down syndrome, it is chromosomal abnormality. In Down syndrome, is trisomy 21. That is extra chromosome present. That one 21. That's why we'll call trisomy 21. In this, we'll discuss about the what is clinical features which is present in the Down syndrome. First one, clinical features. We'll see one by one. The first feature is the flat faces. In the Down syndrome, the flat face will be present. And the second one is the single palmar line. Single palmar line. That one only simian case. Simian cases. And another one is the large protruded tongue will be present. Large protruded tongue. That one only macroglossia. Macroglossia. And in the child, there is a poor muscle tone. Poor muscle tone is hypotonia. In these childs, there is a developmental delay will be present. Delayed development and the mental retardation. Mental retardation. In the case of the Down syndrome, the head size will be normal. Head is normal. There is no presence of microcephaly. Okay. In this child, head is normal only. Now we will see the our options. Semen crisis, yes, it is present in the that is single palmar line will present in the Down syndrome. Second one is macroglossia. Macroglossia means here it is mentioned that is large protruded tongue, and the microcephaly. Microcephaly which is not present, and hypotonia, poor muscle, that is muscle tone present in the Down syndrome. That one is the hypotonia. Which is not present means the option C is the correct answer for our question. That is microcephaly is not able to find out in the Down syndrome. Okay, option C is the correct answer for our question. Now we are going next question. These are the features of Down syndrome. The next one. Which of the following is not a typical feature of fetal alcohol syndrome? Option A, smooth philtrum. Option B, thin upper lip. And option C, short palpebral fissures. And option D is macrocephaly. In the question they ask, which is not a feature of fetal alcohol syndrome. Now we will discuss about fetal alcohol syndrome. Fetal alcohol syndrome. The fetal alcohol syndrome means in the pregnancy, mother consumption of alcohol, it will crosses the placenta and it will affect on fetus during the organogenesis. That one will called as a fetal alcohol syndrome. That mainly occurs this consumption of alcohol during the pregnancy. Why it is occurs and what is the clinical feature? What is the clinical features in that? We'll discuss about the clinical features. First, it's in the fetal alcohol syndrome, the congenital heart anomalies is present, congenital heart defects, and second one is the facial abnormalities. Facial abnormalities. See here, I will show the image. In the facial abnormalities, just observe here. The child small eye opening. Small eye opening. That one only short palpebral fissure. Short palpebral fissures and small eye openings. The child which is present in the fetal alcohol syndrome correctly not open the eyes. Only small eyes will be present. And this nasal septum will be short nasal septum. The another upper lip of that one child is a thin upper lip, and the see here, which is the space present between. See here, observe the smooth filter here, smooth filter, smooth filter, and again that is small chin will be present. That one small chin, small chin. That one will be called as a micrognathia. Micrognathia. That one small chin. And in case of in the fetal alcohol syndrome, the small opening, short nasal septum, and thin upper lips will be present, and a smooth philtrum and the small chin will be present in case of the that is this one is the facial abnormalities, and the other abnormalities in case because of the that is alcohol withdrawal symptoms, there is a chances of occurs seizures, respiratory distress, respiratory distress, and there is a chances of the seizures, respiratory distress will be occur because of the alcohol withdrawal symptom, because of this one is the alcohol withdrawal. How we can prevent the this one? How we can? What is the treatment we can give in the case of this one? The treatment is to control the seizures. We have to decrease the environmental stimuli. Decrease the environmental stimuli. Environmental stimuli. What will do if seizures means if seizures occurs? If seizures are present, means we have to prevent injury and maintain an airway. Prevent injury and maintain airway. Maintain airway. And if the alcohol withdrawal symptoms occurring means the drug of choice is DOC in alcohol withdrawal symptoms. In the fetal withdrawal symptoms, in case of fetal alcohol syndrome is chlordiazepoxide. Chlordiazepoxide, and the best brand, the famous brand is Librium. Librium is the drug of choice in case of the fetal alcohol syndrome withdrawal symptoms. Okay, now we will go to the our answer, which is not here clinical features. First one is a smooth filter. Yes, it is also features of fetal alcohol syndromes. Thin upper limbs. Yes, it is also. And the option C is a short palpebral features. These three also features are present. And this is answer for our question. This is macrocephaly. That is option D. The macrocephaly which is not present in the our fetal alcohol syndrome. That is presence one is microcephaly. Microcephaly presents in case of fetal alcohol syndrome. Okay, the answer for our question is option D, that one is macrocephaly. Now we will go to the next question. Which of the following vaccines is contraindicated in immunocompromised children? Option A, DPT, option B, IPV, and option C, MMR, and option D is hepatitis B. In the question asked, which vaccines will not give in case of immunocompromised child, like that question asked. All vaccines That is, all live vaccines are contraindicated. All live vaccines are contraindicated in the children of immunocompromised. Contraindicated. The all live vaccines are contraindicated because the live stain which we administered to the child means there is a serious, because of previously only that is immunocompromised, immunity is low. If we are giving a that is live vaccine means there is again the chances of more severe, that is it is also affect on the immunity, and there is a chances of severe infections because of the immunity level will be decreased when by the administering of live vaccine, and it is not useful in the case of the immunocompromised child. And there is a that is killed vaccine we can able to give, but that is no more effective in the case of, but we can able to give that, we can able to give that one killed vaccines. Which are the live vaccines? I will tell you. Now, what I will tell the mnemonic for that one, the live vaccines, that is my live TV BJP. This is a mnemonic for the live vaccine. The first one, M means MMR, Y means yellow fever, and the L means that is live influenza, and T means typhoid, that is oral typhoid, B means BCG, and J means Japanese encephalitis, and P means polio, that is oral polio vaccine, oral polio. These are the example for the live vaccines. These all vaccines are not given in the low immunity child, means immunocompromised child. Now we will see the options. Option A, DPT, this is killed vaccine, will not give. And option B, that is IPV, that is also not mentioned in the which vaccines I mentioned in the below. IPV also not there. This is also will not give in the child. And the option D is hepatitis B. This one also hepatitis. These are the killed vaccines. DPT, IPV, and hepatitis B. These are the killed vaccine we are able to give in the immunocompromised child, but all live vaccines are contraindicated. Means MMR is the live vaccine that is totally contraindication. That's why option C is the correct answer for our question. That is measles, mumps, rubella, MMR. Okay. We'll see the next question. The characteristic feature of congenital rubella syndrome. Option A is cataract, PDA, and sensory neural deafness. Option B, microcephaly, jaundice, and hepatomegaly. And the option C is spina bifida, clubfoot, and CHD, congenital heart disease. And option D is cleft palate and polydactyly. In the question asked, which are the characteristics of congenital rubella syndrome? We'll discuss about the congenital rubella syndrome. The congenital rubella syndrome means the infection which presents in the mother, it will crosses the placenta, and if it affects on the fetus during the organogenesis, that one is called as congenital rubella syndrome. And the clinical features of congenital syndrome means the first, I will give the mnemonic for that one. Mnemonic is hear me. Mnemonic is hear me. This one is a mnemonic for clinical features of congenital rubella syndrome. First, we will see the one by one. First, H means that is heart defects, especially PDA, patent ductus arteriosus, and the second one is eye defect, that is cataract, and third one is auditory defect, that one is a sensory neural deafness, deafness, and the fourth one is R means that means retardation, and the fifth one M means microcephaly. Last one is E means encephalitis. Encephalitis. These are the characteristic features of congenital rubella syndrome. That mainly the congenital rubella syndrome, it transfers in the first trimester. It will cross the placenta in the first trimester only. How we can able to find out? That's how we can diagnose. We can, in this case of the we can in the rubella congenital rubella syndrome, we can able to find out by the, that is, that MMR vaccine titer means rubella titer we can do, and we can identify the vaccine is given or not. Now we will see the one by one options. The option D, cleft palate and polydactyl. Cleft palate, it is not mentioned in the clinic characters pictures which I explained in front of you. The cleft palate also not there, and polydactyl also not there. Okay. And the spina bifida, clubfoot, and congenital heart disease. That congenital heart disease is present, but in this spina bifida and clubfoot is also not present. It is option. That's why this option C is also I'm eliminating. And the option B is microcephaly is present, but jaundice and hepatomegaly is not present in case of the congenital rubella syndrome. That's why option B is also eliminating. The correct option for our question is, correct answer for our question is option A, that one, cataract, PDA, and sensory neuronal deafness. Sensory neuronal deafness. This one triad in the congenital rubella syndrome. A is the correct answer for our question. Now we are going to next question. The gold standard diagnostic test for cystic fibrosis. Option A, nasal potential difference. Option B, stool stage test. And option C, sweat chloride test. And option D, DNA analysis. We'll discuss about in detail in the case of the cystic fibrosis. First, going to the answer for this question. In the question asked, what is the gold standard diagnostic test for the cystic fibrosis? Which is the gold standard test for diagnostic of cystic fibrosis, like that question asked. We will discuss about the cystic fibrosis. Okay, discuss about cystic fibrosis. Cystic fibrosis means it's a chromosomal abnormality. Chromosomal abnormality. In this chromosome number 7, it is affect in case of the cystic fibrosis, and it is the pattern of gene. The DNA pattern is autosomal recessive disorder. Autosomal recessive disorder. And in case of the cystic fibrosis, what will happen means the exocrine glands which is present duct to the exocrine glands, the all secretions from the exocrine glands are thick in case of the cystic fibrosis. Means which, and it affects on the systems. Which systems will be affect means the system affects which all of those systems will by, we can see one by one by clinical features. First one is GI system. In the GI system, the secretions from liver and pancreas will be affected. The first is the one by one clinical features. First one is meconium ileus. Meconium ileus. This is the earliest features in the cystic fibrosis. Means the which is the secretions present in the intestine, that is will be thick, and the child is not able to pass the meconium within the 24 to 48 hours, and this is the earliest signs in the case of cystic fibrosis. And second one, another one is the tetoria. Tetoria means the fat presence in the stool because of the secretions from the pancreatic lipase, the pancreatic lipase enzyme, which is helpful for fat soluble, the fat soluble vitamins. It is absent in the case of cystic fibrosis, and the which is actually the fat soluble vitamins from the pancreas to helps to digest in the fat, that is absent in the case of steatorrhea, and the presence of fat in the stool. That's why steatorrhea will be occurs. Another one is the fall smelling, fall smell stool, because of the digestion is not occurs correctly in the intestine, which is bacteria presents. The food comes from this, that is, food comes from the stomach to the intestine. Some of the food particles which is present in that, the bacteria will be eating that one food which is present in the intestine. Because of that one, foul smells too will be present. And we can tell that futures that there is a means a prolapse rectal prolapse because of thickest secretion, that is dry stool. And what will do, for during the passing the stool, the person will be strained. If he's a straining the more, means there is a chances of rectal prolapse in case of the cystic fibrosis in, yeah. The second one is the respiratory system. In the respiratory system, repeated chest infections will be occurs because of, by the inspiration and inspiration which is present in the goblet cells which is present in our body, that secretions of all the respiratory tract will be thick. That's why repeated chest infections, repeated chest infection and COPD infections and bronchiectasis, bronchiectasis and the chronic hypoxia, these clinical features present in the respiratory system. And we'll see the integumentary system, means skin. In the skin, there is a more sodium chloride level is more present in these kind of the children. In the sweating, the sodium chloride level will be increased. That's why salty kisses symptom which is present in this child. Salty kisses. When, if in the case of the cystic fibrosis child, if we are giving kiss to that children, that taste will be like a salty. That's why salty kisses appears in this symptom appears. Okay. And another one is the affect the reproductive system. In case of a reproductive system, infertility. In males, azoospermia, and in the females, infertility. In female, in male is azoospermia. Means what will happen? The sperm which is not will be present that during the ejaculation, it will not come out because of thick secretions. Okay. How we can find out that one? The test is PET chloride test. Diagnostic evaluation for this one is the PET chloride test. PET chloride test. In this, we'll test the PET of that particular children's. If the value is less than 40, means that is normal finding. If the value is between 40 to 60, means that is, we can, in this 40 to 60 value, we can that one suspect that one there is a chances of cystic fibrosis. We can repeat again after few days. Suspect of cystic fibrosis. If the value is more than 60, then we'll call as that one is a positive test for the cystic fibrosis. In this, there is chances of that is not correct value presence in the some other abnormalities. There is a errors occurs in the value also in case of the atopic dermatitis and ectodermal dysplasia, and sometimes of that is adrenal insufficiency. In that cases, there is a value errors will be occurs. Chances of value error occurs in the case of PET chloride test. What we can do, we can, if there is a chances, what will happen, the secretions will be thick. If secretions thick means, and this is the autoimmune disease, there is no permanent treatment for that, only symptomatic treatment we are giving. In the respiratory cases, we are giving bronchodilators and mucolytics, and the GIT will give the fat soluble vitamins, and the what the secretions with pancreatic enzymes will giving during the food and all. And in the respiratory cases only, what we can do means, we can do the just physiotherapy also we can give. In case of what will happen, skin, that is, we can replacement of the serum, that is serum electrolytes, that chloride and sodium will be replacement therapy will give. In case of reproductive, that is reproductive means, in the case of infertility, in vitro fertilization or IVF we can do, otherwise the child adoption is the option for that in the case of the cystic fibrosis. We'll see the next question. Now we will see the first answer for our question. What is the answer for our question? Nasal potential differences. Yes, this test will be do after the sweat chloride test, because of we can not confirm the by the sweat chloride test, means we can able to find out by the nasal potential difference test also. This is also correct answer, but it is not gold standard test. And stool elastase test, it is identified because of which the enzymes coming from the pancreatic enzymes which is correctly, that is secreting or not, for testing that one stool elastase test we will do. And the DNA analysis test also will do to find out the pattern, which gene mutate, which gene mutation occurs, to find out that one DNA analysis also we can do. But the gold standard test for the cystic fibrosis is sweat chloride test. That one is the option C. Option C is the correct answer for our question. That is sweat chloride test. Now we will see the next question. Which of the following is not a feature of kangaroo mother care? Option A is skin to skin contact between the mother and baby. Option B, exclusive breastfeeding. Option C, initiating in a healthcare facility and continuing at home. And option D is provided to baby with cyanosis. The kangaroo mother care, which is a not future, like that question asked. In the case of the kangaroo mother care, which is a not futures. The kangaroo mother KMC, which is given in the low birth weight babies, will give in the low birth weight babies. Okay, LBW babies will give. And the components of KMC, components: skin to skin contact, skin to skin contact. Second one is exclusive breastfeeding, and third one is early discharge from hospital. Early discharge from hospital. These three are the components of KMC. First one is skin to skin contact, and second one is exclusive breastfeeding, and third one is early discharges from the hospital. And the main KMC will give in the LBW children up to the weight, normal weight, that is 2500 gram. Up to that one weight will give the KMC. What is the benefits? Benefits of KMC to the child: we can prevent hypothermia, and increase the bonding between mother and child. Bonding between mother and child. And the other one is the we can early discharge from the hospital, and there is chances of, we can decrease the chances of infection. Chances of infection. The KMC, who can give KMC? Father, mother, or any family members can give the KMC. And the minimum KMC we have to give for minimum 1 hour we have to give the skin to skin contact, and the maximum is 24 hours KMC we can give. Now we will see the one by one answer, which is a not features of KMC answer. Skin to skin contact is correct option. That is skin to skin contact also, it's a component of KMC. And option B is exclusive breastfeeding. This is also correct. And the initiate in the healthcare facility and continue at home. It is also correct. And provided to the babies with cyanosis. We will give the KMC in case of the LBWs, not in the case of the cyanosis. Okay. In the question asked except, which is a not future. That's why this one is a not future of KMC. Option D is the correct answer for our question. That is provided to babies with sinuses. It will not provide to the sinus babies. It will provide to the low birth weight babies. Option D is the correct answer. Thank you. Thank you so much. We'll see you in the next session.